Hello everyone. We will start the session now. I hope you can see and hear us. I'm thankful to you that you guys showed up. As it was our first seminar, I was not very sure, but that's fine. And we have four speakers with us, actually five speakers with us today. One is, first will be Aditi Kothari. They will introduce themselves. I'm just telling you the name. Aditi Kothari. Second will be Ayushi Mistry. She met into pediatric. Third one will be Zeel Patel. Fourth one will be myself, Arjun Kelaiya, and I will be moderating the meeting as well. And we have a senior as well, Poorvi Agrawal. She's a SEC PG. She is going to PGY2, going to be PGY2 soon in pediatrics. So she will guide us as and when needed. Anyway, so let's start with Aditi first. Aditi, you can start.
Hi everyone, good evening. I'm Aditi Kothari. I am a 2022 graduate from VJ Medical College, Ahmedabad, and I matched in the internal medicine at the Texas Tech University in the 2023 match cycle.
Aditi, you can share your experience as well, like how you approached the USCE part and like how did you find, what was your takeaway points and experience as well regarding different kind of clinical experience.
Okay, so I'll share where I did my rotations and what helped me find those rotations. I did 2 electives one at Mayo Clinic in GI, and the other was at Sinai Hospital in Baltimore. And that was my cardiology rotation. These two I did before graduation. So these were hands-on electives. After that, I did 2 externships. One was through a private agency, which was at the Methodist Hospital in Houston, and the other was at a GI outpatient clinic, which was through a connection that I got. And then 2 more months I did of rotation was at an outpatient internal medicine primary care clinic, which was through an agency again, which is Shivani Bhatt Foundation. So 6 months of rotations in 2 months each. So 2 I did before graduation, then 2 I did immediately after my step 2, and then 2 months I did during the match cycle. So from these rotations, what my conclusion is that definitely electives are better than externships and observerships, in my opinion. But if you're someone who has already graduated or someone who cannot apply to electives, it's not like you haven't missed the bus or anything. Rotations are what you make of them, and if you understand the purpose of doing a rotation, I think any rotation is a good rotation for you. Apart from getting an LOR, I think the purpose of rotation is to get used to the United States system and to make connections and to network, not just with professors, but also with the other students who are in rotations with you, with the residents. So making connections and networking is also a part of doing these rotations. So I think any rotation is a good rotation if you are able to make good use of it. So with that out, I would also like to add that when should you apply for rotations? I think ideally an ideal time to go is immediately after your final year and before your internship. And if it is possible in your college to break the internship, you can go in between during the internship, but anytime before graduation. Extending your internship or extending your graduation and having that like window between your graduation and after completing your internship used to be a good time to go. People used to go, my seniors went during that time, even I did, but it has become a little tricky nowadays. But find out what your seniors did in your college, what is your college rule, and then accordingly. But anytime before graduation is a good time, and in order to do that you need to apply in advance. So 6 to 8 months in advance is the minimum that you need in order to apply. So what was very useful for me is planning well. So plan in advance, plan your entire match journey in advance, a rough estimate. It's okay, you don't have to exactly stick to the timeline, but have a rough idea when you'll do your step 1, step 2, when do you plan to go for rotation, do you have a visa, no visa. If you don't have a visa, take your steps before. If you have a visa, try to go for electives first, right? So having a rough idea will help, and that will help in that will help you in starting to look for the rotations and then applying for those rotations. And how do you look for rotations is another question. So the best place is to ask your seniors from your medical school where did they go for rotations. Google, Instagram, YouTube, those are very good resources. I found my rotation by looking at people's posts from Instagram, right? That okay, so and so hospital is open. It keeps on changing, so there is no point in us sharing with you what all places are open right now. But keep your eye open, see where other people are going, Google it, be proactive. Immediately when you see that okay, this is a hospital which is offering electives, Google it, right? And then look what are the requirements, who do they accept, and then start emailing, right? There's no harm in emailing. Reach out in email. So 6 to 8 months in advance, do this. Okay, if you are in final year, if you're someone who is in final year, then start looking at places, have a rough idea, try to club your rotations together. So if you're going to USA, spending the amount, like spending the money on tickets, then try to club your rotations together. That is also helpful. And keep all the requirements ready. If I may share this one page, I hope you can see my screen.
Yes, we can see.
Okay, so those in the audience can, if you want, you can take a picture. So these are the requirements. I kept all of this ready, right? I applied during COVID, so it was very difficult. There are very few places open, but this is like a general idea. Application form, wherever you're applying, they'll ask for an application form, transcript. So first thing, whenever you think of USCE, you should immediately go to your college and get a transcript ready, right? Because it'll take time. Most colleges in India, we know. So get your transcript ready, finish that. Okay, step one, if you have, it's good. If you don't, it's fine, right? It will just increase your options of places that you can apply to. So step one, keep your CV. It's a rough CV. You don't have to have a very glorified CV or anything. Whatever you did in medical school before, anything is fine. Just a rough CV. No one's going to look at it in detail. Uh, Go to your, if you're in internal medicine, wherever you want to apply, go to the department. Um, get an LOR, rough LOR. Again, it doesn't have to be a great LOR, but something, just Google it, get a template, copy from different places, it's fine. Get an LOR, write a PS. Again, doesn't have to be great. Get done with your TOEFL. It's very simple exam. It doesn't require a lot of preparation. The score is valid for 2 years. A lot of places ask for TOEFL. Get a letter of good standing is a part of the transcript in most cases. Use the AAMC form for your immunization titers. Get a drug screen done. Any laboratory you go, 6 drugs or 9 drug panel they have. The urine drug screen, get it done. OSHA, HIPAA certifications. Your BLS is fine. I think only 1 or 2 places, if I remember correctly, ask for BLS. But if you have, it's fine. And then a criminal background check. Some places ask for this, which can be done at the Passport Seva Kendra in India. And so all of this takes time, right? All of these requirements takes a lot of time to get ready. But if you're uh, again, if you are studying 6 to 8 months in advance and you get all of this ready, it will be very easy for you to apply quickly and get that rotation. So yeah, I think this is it from my side for now. Then be happy to take any questions.
Uh, Thank you, Aditi, for detailed description. I wanted to ask, like, can you comment on your specific rotations, like which one was useful, which one was not that great, even if you paid for it, so people can have some idea about the agencies as well. We are not being politically correct over here. Whichever it is good, it is good. If it is not, the experience was not good, you should just say it. So yeah.
Yeah. Yes, thank you for this question. So I think directly applying to a hospital or a clinic is always better. then going through any agency, it can be any agency. So the free rotation or the paid rotation, if you're like doing at a private clinic, it's the same, right? It makes no difference. If you're paying someone $3,000 and you're gonna rotate at an outpatient clinic, you can do that. You might as well do that by reaching out to the physician directly, right? It'll save you money and it'll save you a lot of mental anguish. Uh, and then again, directly applying to the hospital is always a better idea. I think those rotations are good. Applying at a place where there is a residency program is also better, because then you will be able to participate in all those educational activities that go on, like the morning report, the noon conferences, and all of that. That will be helpful. You'll also get to interact with residents, and I think my friends will share um, how they match at the place where they did their rotation. So participating in all those activities will also help. So applying to a place with a residency program, whether it is a university or community, is the best. And I think even doing an observership at such a place will be helpful, because then you'll be able to make connections and you'll be able to network. So any place with a residency program is your best option. If it's a university, it's even better. And then doing any inpatient, any hospital-based rotation, if they don't have a residency program, is the second good option for you. And then comes the private clinic, uh, like the outpatient, in the outpatient setting. That is also a good option, if not the best. Then going to an agency should be your last resort, ideally. Even though it seems easy, you don't have to plan and apply in advance. You just have to pay, and but you won't get such a good experience. It will not be your money's worth, in my opinion. In most of the cases, I mean, you might get lucky. So
Thank you, Aditi. All right. Now let's ask Ayushi Mistry about her experience and how she found the USCE and how were they.
Hi, thank you, Arjun bhai. Hi, my name is Ayushi. I'm a graduate of Pramukh Swami Medical College in Karamsad, Gujarat. And I majored in pediatrics at the University of Miami's pediatric residency program. So my thing was that I did a total of 5 months of observerships only, observerships and externships, a mix of both. I initially applied for electives at a couple of places right after my final year was done. So my plan was to go after my internship finished. So in my college particularly, we finish our internship in March and we graduate in December. So we have that 8 to 9 months of time to apply for electives, where you don't even have to break your internship or take a leave from internship. So my plan was to do that. Unfortunately, COVID hit at that time, so I could not go to the universities where I actually was accepted for electives. So my only option was to do observerships and externships. By the time the observerships and externships opened up, I finished my exams and I applied to a couple of, I applied for a clinic rotation through Brooklyn, USCE. That was my very first introduction to the US health system. So that was my very first month, and I had applied to University of Miami for my pediatrics observership rotation. So I initially had, like, when I booked my tickets and everything for my flight, I only had one rotation planned, and I had no idea what I was going to do for the next 5 months. But fortunately, everything worked out well, because the thing is, as Aditi said, you have to plan a lot in advance. So I started my applications once I knew that, the COVID is going down, and I know that around this time, the observerships of university programs and the clinic rotations will start opening up. So I started applying, and then I went to US. So my very first rotation, as I said, was through Brooklyn, USC. It was at Lasante Health Center. I'm pretty sure a lot of people are familiar with that. It was in pediatrics again. It's not the best. It was actually one of the worst rotations I ever had. So strictly speaking, I would not go for that rotation, just advising you guys. So what I did was I did a week of a week or 10 days of that rotation. And so I went out. I was in Brooklyn at that time. I went out and I looked at what other pediatricians are in that area. I looked at those clinics and I particularly saw those which were Indian. So, you have that sense of familiarity. So I just went to the clinic instead of like emailing them and calling them. I went to the clinic, asked them if I could volunteer. And luckily, I found one pediatrician who was ready to accept me for 2 months of rotations. Her only condition was that she would give me an LOR based on my work. But because she was short staffed, I had to do reception work as well. So I ultimately got a free rotation out of it. I found out how the insurance system works because obviously I was working as a receptionist and I was examining patients, and it turned out to be the best decision ever. So I would suggest that be proactive. If you don't like a rotation, don't be disheartened. Go out and talk to other doctors. Like, no, the least they can do is say no, right? And don't get disheartened. The like if they say no, that's okay. Like, go to another doctor, try, and just, I guess, shoot your shot. So so that is one of the advice that I would give. So those were my 3 months of clinic rotations. I luckily got accepted for a University of Miami pediatrics rotation program. It was in pediatrics cardiology. On paper, it is an observership, but depending on the attending and the resident team, they do let you examine patients. And so my thing was that I would examine patients. I would go talk to the resident and the fellow about what I did and everything. And then they would advise me on how to go about it and how to present it to the attending. And also they would give me access, because the university gives you access to Epic. You can also write notes and send it to the resident for editing. Um, so basically, my letters of recommendations were for an externship in that university. So it depends on I guess, the department as well. In that particular university, I won't talk about the entire university, but particularly in pediatric cardiology, I was able to examine patients even though it was an observership. So that was, um, I guess, that was the best rotation out of all the rotations that I did, and I matched at that program as well. So we'll talk about that, like being proactive in observerships and externship a little later. But so my last rotation was in SUNY Upstate, which was also one of the programs I applied to, observership programs, about 8 to 10 months prior. And I found out I was selected for that observership 2 days before I was supposed to start. So, like, last minute stuff will happen, but you need to, like, as Aditi said, you need to start planning and applying a lot in advance. And that way you can just get as much out of all the opportunities that you have, right? So those are my 5 months of observerships. Coming to what to do in like observerships and externships, I would say that be as much, like, you don't know if the attending will allow you to examine patients, right? So first of all, you need to ask them if that's allowed. You don't want to go into an examination room, examine the patient, and have the attending tell you that, oh, you're not allowed to do that, you're not allowed to have patient contact. So that's a negative point. So that actually happened in SUNY Upstate because I was so used to examining patients in my other observership that I actually decided by myself that, oh, obviously they'll also allow patient contact and I'll be able to examine patients and everything. But that was not the case, unfortunately. So yeah, ask the attendings what you're allowed to do and what you're not allowed to do. Always keep the residents and fellows and attendings in the loop of what you're doing. Another thing I would say is, so when you're like in a particular subspecialty or in a university program, when you're doing your observerships and externships, make sure, so basically they round on patients, like the same patients every day. They hardly have like new patients or new consults. So I would say that go through all the patient records, because you obviously have the access to patient records through Epic, through Cerner, whichever the program uses. So I would say go through those records as well and keep yourself updated. And like be as much proactive as you can during rounds. So there's like templates available online. I'll obviously share the templates I have on how to present a case in front of like in during rounds and everything. But do that as much as possible. So you need to do as much as you can without patient contact, and make sure that they see that you will be a great addition to the team if you join residency in that program. So that is one of the main highlights of how to be proactive. And the other thing is, when you're rotating with an attending or a resident or a fellow, after the rotation ends, make sure you send like thank you notes. Make sure you keep them, if you have a very good rapport, make sure you keep them updated. Like I kept all the residents and the fellows updated about my step 3 progress, about my interviews and everything. And they were so helpful. They were ready to give me mock interviews as well for that particular program. So I think that is something that you should keep in mind as well. I guess that's it, right, Arjun bhai? If there's anything that I should be adding.
We'll ask you if someone asks a question. Otherwise, it was very helpful and very candid and very detailed. So thank you for that. Okay. So I'm sorry I forgot to mention the structure of our session initially. So first we will go through all the speakers, and they will just share their experience, how they found the USCE, and how was the experience. And in second part, we will cover the how to excel in USCE specifically. I will start in that, and later on people can add, and in the last part, audience can ask question as well in written form, and we will try to answer if time permits. All right. Okay, so let's move on to Dr. Zeel Patel.
Thank you.
Yep.
Hello, everyone. Myself, Dr. Zeel Patel. I graduated from Pramod Swami Medical College in 2020, and I matched at Philadelphia College of Osteopathic Medicine in Pennsylvania in internal medicine categorical program. So starting and telling about my US clinical experience, I did 5 months of observerships and externships just as Ayushi did, but we did at different places. Same thing happened with me, like what happened with Ayushi. We applied for electives during our internship year and during our final, just after completing our final MBBS, but COVID hit at that time, and we got selected at UIC for electives, but unfortunately we couldn't attend that elective due to COVID. And so I rescheduled my program and I gave my step exams before that, and I went for observerships and externships during last year. So starting about my US clinical experience, I did 2 months of observerships via Brooklyn USCE, and 1 month was in gastroenterology program, and the second rotation was in internal medicine. So in the gastroenterology program, the doctor was affiliated with SUNY Downstate. So I got a chance to visit SUNY Downstate every week. And it was a pretty good rotation because the thing in that rotation was that I was the only student rotating at gastroenterology clinic with the doctor. So I got to interact with doctor on a one-to-one basis, and I could participate in the like the daily procedures in the office and in the office sessions of the doctor, and I could attend the rounds in SUNY Downstate as well. The second rotation was at Lasante Health Center in internal medicine, and it was a good rotation. I won't say that it was a very good rotation, but yeah, if you want to seek US clinical experience and if you are not getting any other option, then you can go for via any agency. I would not suggest that you should first try for any agency. You should try for a university rotation or for any other rotation via cold emails or anything like that. But if you couldn't find any rotation via that, then you can go via any agency. The third rotation I did was via Shivani Patt Foundation, and it was in internal medicine. I did that at New Jersey. So that was also a very good rotation. I got access to the EMR as well, and the doctor was very friendly. And we were 2 students rotating in together during that rotation. And we used to attend the daily rounds, and we used to communicate all the cases with the doctor. We used to discuss all the cases with the doctor at the end of the day, and We made notes in the EMR, and that went to the doctor for final submission as well. We created contacts with the pharmacy as well. We used to talk with the pharmacy for like reconciling the medicines and verifying the medicines of the patients with the pharmacy. And we got a pretty good exposure at that hospital. The fourth one and the fifth one I did were via contacts, and one of them was a very good rotation. One of them was in Florida, and the fifth one was in Pennsylvania. And it was not at the place where I matched, but yeah, it was a very good rotation. And during that rotation, I got a chance to interact with the doctors and the residents on a day-to-day basis. I used to attend the morning reports and the seminars and the didactic sessions, case discussions. I used to participate in the case discussions, and that helped me a lot to interact with the residents, with the consultants, the ancillary staff as well. And that helped me to create a good rapport with all of them, and I got a chance to discuss all of them with them, and it was a pretty good exposure for me. That hospital exposure was very nice for me. One thing I would suggest for like gaining excellence during the US clinical experience would be to be very proactive during the rotations. Try to discuss as much as you can with the doctors, with the attendings, with the residents, and read that particular topic or read any specific case that you discuss with the doctor on that day, and try to discuss it with the doctor the very next day. That would help to create a very good impact. Like the doctor and the residents would think that you are really interested and really genuine about what you are doing, and your work will definitely be appreciated. And one more thing I would like to discuss is that you should participate in the case discussions and the seminars and the rounds, and just try to be active as much as you can. And yeah, definitely once your rotation gets completed, try to stay in touch with the residents, with the attendings, and try to make them updated and keep them updated regarding what your status is till now. That would definitely help all of you. So Arjun bhai, I think that would suffice. We can continue further.
Okay. Thank you, Zeel. All right, we will take up the question at the later time. All right. So now I'll share my experience. So my name is Arjun Kelaiya. Just a minute. There is some issue in speaker view. All right. So my name is Arjun Kelaiya. I graduated way back from BJMC in 2010-11, and I did my residency after that, did some years of practice, and then gave steps and everything. So only option I had for USCE was observership, because I was like I cannot get elective as I was already a graduate. Where my approach was to ask everyone I knew, because all I knew I have done my homework, so I knew that paid rotation are not that much of a value, especially from the place we take students in however amount, and like so many people have same LOR, similar LOR from that place, or generic LOR. So I asked around. I have a lot of contacts due to from my college, and even after that, all I was able to find was a few of my friends offered me observership under them, specifically in either in their private clinic or in the ICU they were working. That was one of the option. Among the list, I went through WhatsApp list, which is circulating. I am quite sure that you might already have that, and there is another list on AAMC website, but most of them are paid, and as you know, my approach was not to get paid rotation at first. So only free thing and immediately available thing I was getting was the Heart and Vascular Institute in which is a intervention cardiology outpatient clinic in Detroit. And the condition was you have to work for at least 2 months, otherwise they would not give you LOR. And second was not actually free, but I was immediately getting that, and that was Jackson Park Hospital, Chicago, and they offer hands-on inpatient rotation. So which is quite unique in the whole market of rotation, because hands-on to a graduate, it's not readily available. So I have to choose between two, and based on gut feeling, I went with Heart and Vascular Institute. So a few things about Heart and Vascular Institute. If someone is trying to get into it, it's not bad, because best would be, as everyone like speaker before me already told, like if you can get into an inpatient rotation, especially either university or where already a residency program is there, as it would be an audition rotation if you can get that. So inpatient, a university or residency program rotation comes first, which is free, preferably if you are able to find that anyhow. Second would be outpatient, but in this kind of places where residency is there or like it is affiliated university. Third would be private clinic, and in private clinic most there is option of free means by your personal contact, or last will be by paid agency. So paid agency private clinic rotation comes at very last. So Heart and Vascular was free but private clinic, you can say, but it is quite famous for make you work very hard. So as it was my first rotation, it helped me to get accustomed to the all outpatient in and out, like how the mechanism, how the system works, insurance thing, how to approach patient. They allowed us to take history, like thorough history. They allowed us to uh, take patient note inside the EMR. It was a very basic EMR, but at least it was a good start. And it was a very busy clinic. Like even we were like 10, uh, just even we were like 10 to 12 extents per day. Everyone got like 8 to 10 patient per extent. So like it's like sometimes 60, sometimes 80 patients per day. It was a very busy clinic. So it taught us to be efficient as well, because there were 3 attending and everybody had different kind of requirement, like how one attending really like case being presented to them before going inside the room. So it was a good exercise for case presentation. Another attending wanted everything entered into EMR before he comes, and he was very fast. So you kind of have like 5 minutes to ask the patient and enter into EMR. So you have to be efficient in that as well, use the template and everything. It was a very good experience. We worked really hard Monday to Friday. Another important thing for that clinic was if you are proactive and good, you kind of get to manage the clinic as well, because there is one chief extern who is doing actually a job, who is getting paid for it, and he is almost always overworked. So you can, if you are good, you can help in to run the clinic, like a sequence of patients, insurance thing, paperwork, and so much stuff. I did that as well. And third one was like you are working with so many of your colleagues. You find each kind of people, and you know how to work well with other people, like because it is necessary to work in a team in residency. So that was a good experience in the clinic as well. They allowed us to present a cardiology topic. They assigned a topic initially to us, and it depends how much work you want to put into it. I put so much, and but it was a good experience as well. They give you feedback and everything, and it was great. And they allow us to visit a cath lab as well. So overall, if you are not able to find anything, you can use Heart and Vascular Institute. It's like you have to do at least 2 months, and application was initially free. Now I am hearing that they are taking $100 for it. Still, if you are, and the transaction, to be very clear, is like you give your labor, they give you the letter of recommendation. That's it. That's the transaction being happening. Then, and anything above that, that is up to you, how much you can get most out of it. Second, like at minimum, I am still believe that you should have at least 3 months of US clinical experience, because during my search of programs for applying, I realized that minimum requirement for a residency program is usually 3 months. Some require 6 months, and very rarely they require more than 6 months, which can be a year. It is not very practical to fulfill that, but some might. So so I had at least third month to do, and for that I was trying to get a rotation via friends, my contact. So I was getting two rotation in places where there is residency. So I chose one, Mount Auburn Hospital. It was technically a observership, and it required a lot of paperwork. And as a general thing, because I am getting asked this question a lot, like everybody asks, like, can you get me a rotation in Mount Auburn or anywhere, for example, anywhere you already done via your personal contact. So the thing is, not everyone can get you into observership or rotation in a residency place. But the problem here is, like, they have to know you for long. They have to know you professionally and personally, and they have to know you, know your work ethics. If they don't know you well, for example, if I don't know you well, I will definitely not recommend you for rotation, because there is when you recommend someone, your reputation is online as well. So if some random person ask me or ask any other resident for a inpatient rotation, or like in the place where residency program is, usually they will be getting no answer or some excuse for it. I don't know. But what you can do is, like, suppose your best friend is already match this year, and you can ask him, because he knows you for like 4 or 5 years during your MBBS years or undergraduate year. And if he trusts you, if he trusts your work ethic and your professionalism, he can definitely recommend you. So that's the way it works. It is what it is. Same with any kind of personal connection, getting interview, getting rotation, getting observation. So these things work this way only in US Ped. All right. So this was my, and after that I got into research. I accepted the research fellowship in March, but I postponed it till I complete 3 months of US clinical experience. And during my research experience as well, I was lucky to have 2 outpatient clinic day per week continuously. So I could write that in my CV as well, like ongoing clinical experience. And I'm not sure how much it amounted, like how much it was counted, but I wrote like 9 month and ongoing. Whenever I update my CV, whenever I send letter of interest, I will just count my month. It may be 9 months, it may be 10 months, it may be 11 months, I don't know. But I will do the total and add it to letter of interest or in my CV or anywhere where I'm supposed to put it, clinical experience. So this is about my rotation. And okay, so now I will cover like how to excel specifically in US clinical rotation, because I think this is the most important part I want to talk about in this seminar. I have worked with so many people, especially in heart and vascular institutes. So I have seen all kinds of students and who are doing rotations. First and most important thing I would say is professionalism. Like, you have to be on time, or preferably a little bit early, so you can do pre-charting on patient. Pre-charting is like you look up the patient, the lab values and past history and imaging and everything, if you are assigned 1 or 2 patient already the day before. So show up early or on time at least. And second is be very much presentable. Like, see, there is a rule in general, like whatever you want to be. If I want to be an attending, I will act like an attending. If you want to be a resident, you act like a resident, even if you are not right now. So be presentable, wear formals, even if they say like you don't have to, and etc. If it is a routine over there, you can wear a tie as well. Be very much presentable. And third and most important thing among professionalism is finish your work when you are supposed to do, or when you said that you will do. Like if you are going to write a case note today and it is understanding between you and attending, just finish it. How, like, you cannot have any excuse for it. So that comes under professionalism. Second most important thing is, like, as I said, act like a resident. What do I mean by act like a? I have experience as a resident in India as well. That's why I think I should talk about it. First and foremost is take responsibility of your actions. Now I'm seeing my colleagues or like who are going to be resident, they like to, some of them, not, I'm not generalizing, but some of them like to be spoon fed of information. They don't do their homework, but it doesn't work like that. It will not be a good look on you. Take responsibility. um, you not like no, almost no one likes to hear excuses. If you are assigned or if you have taken any responsibility, you have to get that things done anyhow. So that's the kind of mantra in residency: get things done. That makes you reliable and people can trust you, and they will definitely like you, and you will get more opportunities as well. And in US especially, you have to show that you are valuable. As Ayushi has said in her experience, that she was doing the job as a receptionist as well. So the thing was, attending was understaffed and she needed help, and Ayushi showed her value as a receptionist, plus being helpful in clinical work as well. So that's the only thing. See, you are not entitled to anything. They don't owe you anything. If you are valuable, then you are getting a good LOR or recommendation or more help as well. So that's how it works in US. You have to be valuable. Another important thing is be proactive. What do I mean by that? Like, as I said, take responsibility, but responsibility about what? If you are doing a rotation, be it observership or extensive or elective, whatever, you can ask to present a case. Even if you are not assigned to, you can ask that. You can ask to be a part in patient management, not directly, but you can be there during the discussion about the in morning round or before going to see the patient. If you are doing a subspecialty clinic, usually you will be doing, as I was doing, like infectious disease rotation. The patients were referred to us, so usually you have some time to pre-chart the patient, look it up, and read on the case or presentation before you go and see the patient. So take actively part in that. Try to present the case as well. Second is, sometimes some interesting case comes up, you can ask for writing a case report. Usually attending say yes if it is a very unique, like in my case, there was a suspected monkeypox, and I agree, my attending agreed that like we will write it up if it comes positive, but it was not, so we didn't do that. But you can ask that. You can ask for oral presentation for some interesting case as well in their own like noon conference or morning round. I don't, like, wherever they are doing oral presentation, you can do that. The whole point is, don't just go through the motions. Like, I have seen people, they just show up, they try to do as little work as possible just to get by, and they expect the letter of recommendation at the end. If you do that, you will get a LOR, but it will be generic, and you will not make a good impression, or at least impress them, and you will not get more out of it. So that's what I mean by being proactive. And remember, LOR is not your right. You are not entitled to it. Remember? So you don't take it from granted and work for it. However much however work you put into your rotation, you will get in return as a strong LOR. So this was about the professionalism, act like a resident, being proactive. Clinical side of rotation, how to excel in that. So as a resident, you are not supposed to know everything in general, like especially when you are in first year or as an intern. But what useful skills you can have is have a proper case presentation skills. I am not sure we will have time to talk about in detail, But the thing is, there are few ideas about it, key points. Like it should be like a narration, a story. Whenever you present a case, it should be a comprehensible narration or story in logical flow. Like you cannot just put up random things together and say, oh, it is a course presentation. No, make it relatable. What do I mean by that? Relatable. Suppose if you are doing rotation in internal medicine, you can be general. You can cover whole thing. You can cover GI complaint. You can cover cardiovascular complaint. You can cover neurology complaint. But suppose if you are doing some subspecialty thing, right now I'm doing hepatology. So my mentor like to focus on liver part only. We will ignore the orthopedic part or some psychiatric part. So like we will just say a single line about it at the end. But she would like to know more about the hepatitis B virus or non-alcoholic fatty liver disease. As I own cardiology clinic, they was solely focused on cardiological complaint and history about it. So make sure who is your audience. You cannot generalize. If it is internal medicine, you can go over everything. But if it is subspecialty, make it relatable. That's what I mean. Make it relatable. There is a very famous SOAP format. I think everybody knows that, SOAP. SOAP, S is subjective history, O is objective, A and P is assessment and plan. So in subjective history, I'm going to use some general ideas. Like in subjective part, it's like demographic, patient name, new patient or a follow-up, established patient, age, demography, like where does he or she comes from, and chief complaint you can add. Then comes the history of present illness, the way we present in India. And it should cover all the pertinent negative history as well, or associated symptom as well. And at the last, whichever system is pending, suppose the primary complaint is abdominal pain, you focus on that, but then you say rule out other system as well, like patient does not have any kind of chest pain, breathlessness. So RSCV is ruled out this way. In after that, past medical history, past surgical, medicine history and allergy, and family history, and personal and social. So that constitute the subjective part. In objective part, physical examination, general and systemic, labs, imaging, and most important part is assessment and plan. So this is where you can show your knowledge, whatever it may be. Assessment is like how you summarize the patient. What is your thought process? What do you think about the patient and differential diagnosis, and what are your reasoning for it? So that is the most important part. If you are like good with story, narration flow, then focus comes on assessment. And then if you assess the patient very well, like let's say patient have cirrhosis complicated by portal hypertension and with history of hepatic decompensation. So you are kind of summarizing whole patient history in like 2 or 3 sentences, like, and based on that you can make your plan. And it comes with practice. You have to observe other people as well, intern, resident, attending, like how do they make plan, what are they their preferences, and you can go by that. So this is the proper case presentation. So if you have to practice before going into a rotation, try to learn about proper case presentation. It is a very useful skill as a rotator and resident as well. Second is practice-based learning. So as I said earlier, like you are not supposed to know everything, but practice-based learning is one of the key, they have a word for it. I forgot the word, but one of the key factors or expectation from resident out of 6 is described by AAMC. So it is very important. So what do I mean by that? So practice-based. So suppose you have come across a patient that you know nothing about or you know very little about. For example, I had a patient in my ID rotation who had laceration injury in foot in salt water, and then he rapidly developed cellulitis. So I didn't know the diagnosis. Obviously, my attending didn't know the diagnosis. It can be a 6, 7, 8 like laundry list of bacteria. But if ID is very vast, so you have to look it up. Like, okay, it can E. marinara, like there is very rare kind of bacteria who can do that. So nobody cannot, like almost everyone cannot know at baseline, but you can go into up to date, and you can based on the symptom, you can read upon it, you can derive your own differential diagnosis, and you can have like most important one or two diagnoses you kind of suspect, and for your management plans as well, like to rule out or to test for this bacteria, we will do this. So practice-based learning means read up on case, learn about it, and then present it. So it is very much appreciated because that's the only way you can show that you are ready to learn. You are very curious about it, and you are very serious about patient management as well. And other than that, you should observe and learn from your intern and resident if you are doing in some residency setting. So suppose once I was not clear about an attending, like how to present a case to that particular attending. So I simply asked my, there was a PGY2 who was doing elective at the time. I simply asked like how he expect me to do this. So he explained everything. Okay, he likes to listen to this, he want to focus on that. So that way you can continuously learn how, because every attending has different preference, so you can tailor your presentation based on that. If you have an opportunity to examine the patient, you can brush up your examination skills by, there are various YouTube video. One is, I think, Stanford Medical is really good. Another, I forgot, Geeky Medicos or something, but there you will definitely find if you search on YouTube. So if you are going to do hands-on or externship, brush up your examination skills as well. It is very useful if you show that you are well prepared. So this is about whole clinical side of thing. And one important thing, how to ask for an LOR. So you say, okay, it is obvious, everybody expect like attending to write an LOR, but it's not like that. Sometimes some university programs say that you will not be given an LOR. They say that, but if you work really hard or work really like follow all the good things or good protocols, you can say, you will be granted an LOR, but you have to ask for it. So now important thing to note over here is anyone can give you LOR, and it can be from any post, be professor, associate professor, assistant, or just an attending or instructor. But the important thing to note here is you have to have a strong LOR from anyone, strong. So suppose if you ask me after like 3 weeks of rotation, Dr. Kelaiya, can you give me an LOR? I will just say yes from the top of my mind. But my mentor suggested me that you should ask like, do you know me enough to write me a strong letter of recommendation in support of my residency application? So why should we ask like that? So if you ask like this to someone, they have to think like, do that like, do I know him enough to write him a strong letter of recommendation? So that is the strong is a keyword over here. So do your work and ask for a strong letter of recommendation wherever you are doing a rotation. All right. Anyone can give you LOR, but strong is the strong LOR that usually works. And another thing I've noticed, like when people are doing rotation, they just keep on trying to get more, but they don't focus on the current rotation. Like they just kind of ignore it. Either they are just preparing for step 3 or doing some other thing or asking around rotation, but they are just getting by in the current rotation. So that's not a usually good strategy to do, because you have worked so hard for a rotation. Don't take it for granted. Another thing is be kind to everyone, and always remember that you are being evaluated all the time. It can be 7 a.m. or 7 p.m. It doesn't matter, first day or last day of rotation. You are being evaluated all the time. And be kind to everyone, maybe ancillary staff, your peer group, obviously attending, and patient. But I have a very interesting anecdote for this. So in my Mount Auburn observership, my primary attending was a single guy that I wanted an LOR from. But there was another attending who recently joined over there. So on my last day, he asked me directly, like, do you want a letter of recommendation? I can write you a very strong one. Like, I was not planning to do that, but he offered me. So obviously you don't say no to that. I said yes. The interesting thing happened was, like, I only worked with him for a week, so he didn't have much to write about me. So in follow-up email, he asked me, like, okay, send me the list of things you did with other attendings as well. And that I did. I sent him a summary, whatever I did, case presentation, some specific things I did with other attendings. And what he did, he asked other attendings to sign the LOR as well, including the chief of infectious disease. So what I mean by so what happened was, ultimately I got a departmental LOR, like, which had a signature of 4 attendings, including a chief of infectious disease. And it was the heaviest LOR I got that I was not planning to get. So the point is, be good to everyone. You never know what happens. So yeah, this is about it. And yeah, another important thing is how to excel in observership when you are not allowed to touch the patient technically. So this is very subjective. It depends on your reputation or rapport with attending. But in what is in your hand, so you cannot directly ask the patient history, you cannot examine, but what you can do, you can pre-chart with resident. You will not have EMR access, still you can go with the current resident, maybe PGY 1 2, and like look it up on the labs and history and past imaging, everything on computer. Prepare a case by looking up on UpToDate or any other resources you would like to use. Discuss with resident and present it to an attending before going to see the patient. So if you do that, so even if you are not directly involved in the patient care, you will, like, your thought process, which is very important, like they will like to know how you think, your thought process will be evaluated. And in that case presentation, if you can assimilate assessment and plan, which shows your knowledge on your critical and analysis thinking, then it would be very beneficial. And maybe after a week or so, if you can ask as well, like, can I ask history under your supervision, or can I examine the patient? If they are comfortable with you, if they are confident in your skills, they will probably allow you to do so. And yeah, that's why, like, they show your good work. And even you can turn just a plain simple observership into, or shadowing opportunity into, a very interactive one. You can discuss the case after you see the patient as well. Like, you can, if you have some question or good follow-up question, or if you have some thoughts about other differential diagnosis, you can discuss with attending. Like, it is okay to be incorrect. See, you have to be okay with incorrect, but at least you should have some thought or logic to your question. If it is there, everybody will be fine. There is no issue. So in that way, there are no bad questions, there are no bad requests. You should be at least reasonable in that. That's what my mentor says currently. So that's about it in from my side to how to excel in US clinical experience. Anybody from the other speaker can add. We can start by Aditi and Ayushi and Zeel.
So we covered a lot of things, a lot of very important things. I would like to add certain things. So maybe what I found useful was, you while doing the rotation, they all see that you are here for the LOR, right? But what you can do is preemptively ask your attending, like, what are your expectations from me during this rotation? Whether, so there are different types of rotations. It can be a floor rotation, it can be a consult service, it can be outpatient. So if you preemptively ask them, like, what are your expectations from me? What can I do to get a good LO, or any of those things? You can ask them one on one, like if you're not comfortable in a group, and then based on what they say, try and do those things. And if you have one attending for the whole month, or sometimes the attending changes every week, right? So depending on that, depending on what the situation is, midway during the rotation, you can ask for a feedback. it is very important to ask for feedback in USA. Ask them, how am I doing? What can I do to improve myself? um, any of those things. So it's important to ask for feedback, and that is very helpful. The feedback will help you not only in that rotation, in the next rotation that you do, in general. So ask for feedback, try to implement that feedback, and if you implement the feedback in the next half of your rotation, you will, in the end, you can ask them, did I do well? And then will you be comfortable in supporting my application with a letter of recommendation? So this is something you can do, which I found helpful. Another thing is, like everyone said, being proactive. So what I did was, it was a GI rotation, it was a flow rotation. So we would do rounds, see patients, and then write notes and everything. But what I did was, there was one particular patient that I was following, and the patient had a GI procedure, a stent placement that was scheduled later in the day, in the evening. So I did my day's work, and then I also proactively went and decided to watch the procedure. I went to the endoscopy suite, I interacted with the fellows over there and everyone else, and I saw the entire procedure, even though I had to stay back late. And the next day, when they were discussing the patient and they were talking, they had a question, something about what happened during the procedure. And then I was able to say that I was there in the procedure with them, and this is what happened, and this is what they used. And this really impressed my attending. And I was very happy that I was following my patient completely, like in every possible way. So try and be proactive, see what you can do aside from the usual stuff that is expected out of you. And then staying in touch with your attending. So I had a cardiology rotation, which was in 2021, and I applied in 2022 September. So during that time, I did a research in cardiology, my abstract. So I would keep my attending updated on that research. And then I did another rotation, was a GI rotation, and coincidentally, I recorded a GI podcast. So I sent my attending that podcast, that recording, and I told her that how much I learned from her during my rotation, and that is what I incorporated in my podcast. And she was very happy with the podcast. She listened to it and gave and like praised me and all of that. So find ways to stay in touch with your attending, so it will be helpful to you at the end when they upload the LOR on eras. And lastly, I would like to add some of the things that you should absolutely not be doing during the rotation. uh, I've heard a lot of residents and attending discuss things that students do which are not very good. So first thing is, this is very, very, very important, is please don't interrupt anyone anytime during your entire rotation, whether it's during the rounds, presentation, in general. Even if anyone is speaking anything, I don't know, we are habituated that way, or we don't have that adequate. A lot of students that we tend to interrupt, we become excited, or we try to show off what we know, whatever the reason may be. But don't interrupt. They absolutely hate this over there if you interrupt anyone, whether it's your student who's rotating with you, resident, anyone. Let them finish and then add your point. Another thing is, don't try to show off your knowledge. They don't want an intelligent person on their team, or they're not impressed with someone who is very smart, who knows everything, who knows all the differential diagnosis, all the treatments, all the doses. That is not what they're looking for. They're looking for someone who is polite, someone who is teachable, someone who can work in a team. So it's not necessary for you to show off your knowledge, show that you know more than the residents and all of that. Ask questions, be polite, be humble. It's okay if you cannot uh, tell them everything that you know, but if you're teachable, if you ask questions, and if you're humble, that will create a much better impression. And at the same time, don't be shy and quiet all the time. We are like that, but try to speak, try to interact, ask questions, try to talk to the residents or other students who are in the rotation with you. Make small talk, make small conversations. That is going to be very helpful, and that will that will make people notice you. And then, like Arjun said, don't be lazy, don't be late, and also don't bad mouth your country, talk negatively about your system, something that you don't like. Say back home it is like this, that. Don't try to speak negative about your home country and the medical system. in your country. And at the same time, and this goes without saying, don't talk negatively about the US healthcare system. Whatever your opinion may be, this is important. If there's something that you don't like, please keep your views to yourself. In general, don't talk negatively about anything. So these are some of the don'ts that please try to avoid. And students have done this in the past, and it didn't go well for them for obvious reasons. So yeah, this is it from my side.
Excellent points, Aditi. Especially, I would like to add on like two things you said, being proactive. Like everyone, we are saying being proactive, but what it actually helps in writing specific things or specific example about you in LOR. So if you have like if you try to present a case report or some presentation or write up a case, like whatever specific thing you do out of ordinary, that can go into an LOR. And your LOR can stand out by like that. So it is one of the, I think, most beneficial effect of it. And regarding bad mouthing your country, I would say my mentor told me, like my current mentor in research, she said like one PD also said, not directly to me, but indirectly to my one of my friend, that if someone can badmouth their previous place, they're definitely going to badmouth my place later. So you have to be really so in US. So see, I do not agree with this with personally, but yeah, to in US you kind of have to be politically correct about certain things, your country, your past clinical experience, or your experience with a previous mentor, your experience with previous rotation, anything. Be very careful about what you say, especially do not say negative. Okay, even if you have to say something about it, be positive. Highlight the four positive qualities. This will also come up in interview, because they will try to push you toward it. Like they will ask you like why do you want to come to the US, or they will ask like what is the difference between US and India, or whichever is your home country. So they are kind of looking like what you say about your previous system. And US system also has some issues. It's not like it is very perfect. It's kind of far from perfect. So they will just focus, like they will just see like what you focus on. It's like a attitude check. So yeah, that's it from my side. uh, Ayushi,
I can add
do you
on.
want to add?
Go
Yeah,
ahead.
Poorvi.
I'll just introduce a few very brief about me. You guys have covered it all excellently. I think my talk will be an example of what not to do because
Yeah.
I had US clinical experience. All right, so I am Poorvi. I matched into University of Florida Pediatrics program, and it was always about pediatrics for me because I have done my MD in pediatrics in India as well. I'm an old graduate to begin with more than 10 years of graduation when I applied. And when I woke up that I wanted to try the healthcare system of US, it was already COVID time. So no electives, of course. Nobody would answer for observership. And to like cherry on the cake, I did not have a visa. So I would say my case is a perfect example of how to plan things from ahead and what not to do. So first thing I would say is get a visa. I know when I was trying for visa, it was a long battle because of COVID. But there's a consensus around that apply for a visa when you have observership on the basis of observership. I think that's a very tricky thing to do. I would say apply for a vacation. I would say apply for a family visa. Say I want to celebrate Christmas. Say I want to celebrate my birthday. If you're married, say I want to celebrate my wife's or husband's anniversary, whatever. Like uh, I would say it is a very tricky thing to get an observership and then not to get a visa instead of having a visa in ahead for whatever social, travel, tourism reasons. I would strongly advocate getting a visa much prior in hand before observership. Second thing, I know everybody faces the same question: how to get your observership. Like these guys have covered it all. I can tell you from my experience, and that was in the COVID era where nobody would reply to you because of obvious reasons, and even if they replied, the restrictions did not allow them to get observership. But how did I manage my way around? So take me as a layman with no knowledge of US, in fact, no knowledge of US map as well. So I began with geography. I took the map of US, took the states. I pointed out the hospitals where I can have even meek connections, or in fact, even if I know an Indian name who could possibly help me if I reach out to them. So I took out the map, pointed out the states, the hospitals, went to their websites, approached the resident / attending whom I thought was approachable. And fortunately, they do reply. It can be late, but they do reply. Of course, the percentage could vary. Sometimes you would get replies in 1 out of 5 times. But one thing that I found, it is always better to approach the PD or the program coordinator directly rather than making your way through the resident whom you know. I would say try both ways, like approach your resident versus anybody you know versus approaching the PD directly. You will be surprised about the number of times the PDs reply to you versus not replying. They're quite proactive in replying. So I was very fortunate enough that almost every PD that I emailed just blindly, that I'm really interested in your curriculum and I want to observe how it works. They do reply to you. So we do think that emailing the PD is not a good idea just for observership, but it is surprising that it is the best idea to do. Third thing is there are many alumni WhatsApp groups of your own college from where you've done your MBBS or internship or whatever hospital you've done. Just blank WhatsApping into that alumni group that, hey guys, I'm this from this batch and I'm looking for my career ahead. If there is anybody in the States who thinks that can help me navigate my way, it is one of the other best ways to find observership. I got observership at University of Minnesota, Rochester, but again, the COVID restrictions did not allow. If it was not era, definitely that observership experience been gained. So another thing is approaching your own alumni. Fourth thing, I would say tele-rotations were a scam. Like, though I did not have any rotation, I was very much desperate to get one clinical experience. And I did get one tele-rotation, but the whole idea is wrong. Why do you need an observership? The word itself says observership. That is, you observe the system, you get acquainted to clinical scenarios as well as non-clinical scenarios. What I mean by non-clinical scenarios, the etiquettes, the way to deal with your patients, with your colleagues, with your attendings, everything. So nothing can be done on a tele-rotation. Like it is better to watch a series like HHoU versus Grey's Anatomy rather than doing tele-rotation, I would say. And it is a lot of money. If you convert into INR, it's a lot of money. I would really suggest against it. I had like zero experience, still I did not go for it because it just did not sound right to me. Fifth thing is we always talk about electives, we talk about observerships, externships, hands-on things. I would say there are some offbeat clinical experiences which we do not know about. What I mean by offbeat clinical experiences, there are few very prestigious hospitals in US who want to spread global knowledge. What do they mean by global knowledge? Inviting people, physicians, students, practicing physicians from middle income countries, lower income countries, except we are middle income countries versus lower middle income countries. They invite people or working physicians globally to come and observe the system in US and give them some stipend as well, just to spread good work ethics, good clinical practice guidelines, right? We never knew about it, but I did discover there's something called global internship, global scholarship program run by Boston Children's Hospital of Philadelphia. Like, these are very prestigious places. Even if you don't get an LOR from there, imagine putting that experience into your CV. So people like me who are old graduates and cannot get electives, blah, blah, such global scholarships, just type global scholarships for physicians over the world and look into the websites. You will be surprised at how much they are extending their help just to promote good clinical practice all over the world. So that's there. Another thing, there are some 4-week versus 6-week fellowships. Again, trying to motivate people and physicians from other countries to practice, for example, good pediatric diabetes practice. I was accepted into a fellowship. Again, COVID hit and I wasn't able to do it. It was just a 6-week fellowship. Imagine how it would change your whole CV. And they would sponsor visa, they'll give you stipend. In the whole idea about offering such fellowships to middle income people is promoting good clinical practice, but it can really work wonders in your CV. That's about offbeat clinical experiences, which you can try to apply parallelly apart from your observerships and traditional clinical experiences. Sixth thing I would say is going to, for example, I was really interested in Mass General Hospital, for example, going to their website, uploading your CV into the jobs and careers profile where they want to hire research assistant. I would say plain observership against some months of research assistant post. Arjun will also back my point, is it does go a long way. So, uploading your resume into the hospital's website where you're interested into matching for a research assistant or a research coordinator or whatever post is applicable to you is again a very good idea, apart from just apart from getting just observership experience. Of course, you can turn your way around with observerships, but if you plan much in ahead and if you have 1 year, patching into a 2-tier program versus 1-tier program can go as planned if you do things like this, like research assistant, coordinator, and apart from traditional observerships or clinical experiences. So these were a few points from me and things to learn from my case, which never happened. But yeah.
Thank you, Poorvi, for excellent points and useful tips. All right. Okay? Zeel, do you want to add anything to the discussion?
Yes, I think majority of the points are covered, but I would like to add few points. So one of the thing I believe that would help you to excel in your US clinical experience is that during your free time or during your break time, try to be adamant in accompanying the professors and the doctors and the residents all the time, and try to accompany them as they speak to the patients, families, and their relatives, and keep asking questions to them. Like, come up with good questions so that they can think and they can feel comfortable that yes, this student is a good asset to our residency program or to our hospital. Second thing I would like to add is that be regular in your work. Try to integrate with your team and try to integrate with the ancillary staff as well. So that's also a very important point. To excel in US clinical experience is not only to be interactive and communicative with your doctors and the residents. The supporting staff having equal importance as well. So try to be good to them and try to like do respect them and try to integrate with them and communicate with them in as equally as you communicate with the doctors. And one more thing I would like to add is be like read about the particular topics and try to discuss and try to be active during your US clinical experience, and just keep on discussing the things with your doctors so that they can stay updated regarding you and you can stay updated as well. So these were the few points that I would like to add.
Great points. And before I forget, as a follow-up to Poorvi's point regarding working as a research assistant or postdoc fellowship as I'm doing right now, so that obviously it is superior than observership, because like you are assigned some responsibility in that. You are supposed to do something compared to observership, where you are just supposed to do nothing and just shadow the attending or residents. So when you are assigned some responsibility, where it may be medical assistant, it may be research assistant, it may be postdoc fellowship, your mentor can comment on your work ethic, your critical thinking, your teamwork, your professionalism, and your clinical acumen as well, if it entails some clinical duty. So it is obviously far more superior than just plain simple observe. I'm not talking about observership where you can kind of get hands-on like I did. That's different thing. But if you are not able to find anything, look this up as well, as Poorvi has suggested, by going into the job or career section on reputed hospital, reputed places where you want to do residency, or even if you are not able to get a residency due to any reason, if you can get an LOR from that place, it would work wonder for your CV and your residency prospects. Okay, so that was it. And during observership, like try to make a good rapport not only with attending, like residents and intern as well. Like how it worked in my favor. Few of during with like I interacted with so many residents during my infectious disease observership, and few of them actually asked me during inter season, like, should I recommend you, or do you already have someone to do so on behalf of you? So if you have a good rapport, that will work. Few of them actually helped me with personal statement, my CV, and my even they told me a few things like, do you are probably going to be asked about this in an interview. So if you are good with people, it certainly helps, and like it can go to any extent. Even I will not say the name, but I had an interaction with one PGY2 from some other program for a day, only day, single day, and we she liked me at least much that she offered me to recommend me directly to her PD, because he was going to do an outpatient rotation just after the electives he was in, and it was my third choice program, so I really like the program. So it just turns around your rank order list from hospital side. Like you might be on maybe middle place, but you can just come on to the top if someone within the program just recommend you, okay, he's a nice guy, he has good experience, he's a good team player, I strongly recommend him. So you never know what works. Be kind, be professional, and be good with everyone. Okay. Ayushi, if you want to add anything.
I think just an add-on to Poorvi Didi's point. If anyone is Googling, the one program that she mentioned at CHOP, the Children's Hospital of Philly, is called, if I'm not wrong, the International Physician Observer Program. It's a very good program to be in if you're looking for just experience of the US healthcare system, especially in peds. They do specify that they should not be included in your tryst with applying to residency, but that means that they won't be giving you an LOR. but obviously it's a very, very good add-on to your CV, and that would be like a talking point during your interviews as well. Another thing that I would just add on to whatever has been said is no task is beneath you. Make sure the littlest of things are noticed by the attendings. For example, in one of my observerships, I realized that they would keep the tissue boxes for the relatives in under lock and key in the pharmacy. And so during the counseling sessions, I remember one of the parents crying when the attending was counseling them, and I had a box of tissues in my lab coat, and I passed it on to them, and it was actually mentioned in the LOR that the attending wrote, seeing that how you notice little things, the little deficiencies in the system, and how you go about it. So make sure you see what's going on around you. You try and work your way around it, and obviously, like, keep in touch with your attendings, your fellows, your residents after rotations. Like Arjun bhai said, even the residents and fellows helped me with my personal statement while I was applying for residency. They were more than happy to write me an evaluation letter. So I also submitted an evaluation letter from the residents and the fellows that I rotated with. So that worked as one of my letters of recommendation as well. So it doesn't matter. It doesn't have to be an attending. It could be anybody. It could be the ancillary staff. It could be just the residents, the eco technicians. Anyone could write you a letter of recommendation as long as it's a strong one. I guess that's it from my side. Arjun bhai, should I address some of the questions on the chat?
Yes, please go ahead.
Okay. I guess, is it good to ask for expectation to attending in the first week itself? So I would say the expectation of what you should be doing should be asked right on the first or the second day. After the first week, you could frame the question as in, oh, now you've had the time to observe me for a week. What, in your opinion, should I be doing differently? What, in your opinion, should I be doing more to, increase my chances or increase my learning? So that kind of a follow-up should be after a week. But I would say in what you can and cannot do, those questions should be before you start your rotations. I hope that answers that question. Uh, should I keep on going, or should I?
Yes, please keep on
Okay.
going.
What is the best way to know that a hospital has a residency program? Google it. There are a lot of information if you just Google it. For example, if you Google my program, University of Miami Observership, the first link you'll find is the Observership program. It's not that hard to Google it. Look at people's LinkedIn profiles. So that is something that I did. You look at people's LinkedIn, people who've matched, look at their LinkedIn profiles and see where they've rotated at. Ask them how they went about their university rotations. And if there's an email address that is not listed on the website, that you should contact them on. Another thing, just an add-on to the etiquette point that Arjun bhai said, when you're asking someone for help, don't just mention, oh, how did you get this rotation? Introduce yourself. Hi, I'm this from this college. I'm applying for rotations. I'm applying for observerships. And I think if you could help me, with this rotation that you did and how you went about it. So it's not that hard to, just type in a few more words of introduction before you ask someone for help. I think there's someone else wants to add on to those questions. Aditi, Zeel, Arjun bhai.
Yeah, if I may add, in order to know whether they have a residency program, just write the name of the program. So, for example, Texas Tech University, and then pediatrics or internal medicine, and then internal medicine residency program. Just type this in Google, or you can also use Residency Explorer. That is a very good tool. It is free. It is from AAMC. Search on Residency Explorer, and you'll come to know whether they have a residency program or not, a particular hospital.
So it can go both way. As Aditi mentioned about Residency Explorer, by that you know the name of the residency. If you know the name of the residency, you can definitely search on Google about the hospital, about the observership program they may have, about the contact person for that, or about the faculty as well, where you can, to whom you can write cold email for sponsorship for an observership or clinical experience. So if you just know wherever the rotation residency program, and then you just use Google and be like, do your homework, you will get it. Next question, Aditi, Ayushi.
I can take this one. I'm done with my step one and I'm confused about whether I should do my clinical rotations now or completely focus on step two. I'm applying to for match in next year, so 2024 match, I assume. So I think I don't think it's in your hands. Honestly, just apply for rotations. If you get if you get good rotations together, then go for those and come back and take your step two. And if you're not getting rotations, meanwhile, continue to study for step two. And whenever you do get an opportunity, you can go for your rotation. I think it's important to focus, give importance to rotations because that's something that is not completely under your control. So whenever you do get an opportunity, go for it. And then step two is something that you can do. It's in your hands. So meanwhile, focus on step two. But if you're nearing your end, say 1 or 2 months of step two prep left, then I suggest that get done with it, and then go for a rotation.
Just at a side point, don't compromise your step two score for anything. Try to get as high a score as you can. I have done that mistake, but yeah.
Same as Arjun bhai, I would say I actually gave my step one in between two rotations without taking adequate dedicated period before my steps. I'm sorry, my step two. So I would say that focus on your step two first, because once you're in your rotations, you won't have the time to study for step two. Even if it's, if you think that, oh, I can come in the evening and, study for 3-4 hours before dinner or after dinner, that doesn't work. Like if you need, for when you're doing your rotations, focus completely on your rotations. If you're doing your step two, focus completely on your step two. I made the same mistake and I regret it. I ended up, like my score ended up being less than my step one. Not a very big deal, but it still would hamper your chances.
Agreed.
I can also, I think, take the next one as well. My college is non-PSLO, which closes off quite a few good university options for us. Does it affect the chances about getting a good USCE experience? A lot. It doesn't. My college wasn't VSLO sponsored as well, but we did end up, for electives especially, we did end up applying to a couple of university options. It does close off some university programs, but it doesn't close off all of them. Especially if you have a step one score, it'll increase your chances of getting into a good elective program as well. So I would suggest, instead of worrying about things that you can't really do anything about, just focus on what you can do, finish your step one, and then apply for your electives, and that would work wonders.
That is a very good life advice as well. Just focus on things you can control. Don't worry about things that you cannot do anything about it. So, yeah, great one. Next, Ayushi, you can continue taking the question.
I think the next one was a TOEFL question, if I'm not wrong. Even though the college course is in English language, would it be advisable to give TOEFL? Yes, they do need TOEFL. Even most of the medical courses in India are taught in English, but you still need a TOEFL score. I would check with the individual programs if they accept OET, since OET is one of the necessary items you need to apply for residency. And if you're closer to the residency application deadline, I would suggest just giving OET instead of TOEFL and just saving that money. See if they allow that. Most of them do. So you can just ask the individual observership or elective program that you're applying to. Most of the elective programs would need TOEFL instead of the OET, but I think they would make a concession if it is an observership program.
Just one thing I would like to add on this question is that I didn't give TOEFL, even though my college course was in English language, and I gave OET. I didn't give TOEFL, and it worked out for me in few universities. But yeah, many of the universities, they ask for TOEFL scores, and it would be advisable if you could go for one.
And a very side thing regarding TOEFL. TOEFL, I hardly believe TOEFL is an exam itself. Like it doesn't require
Yes.
much of the preparation if you're used to English movies, like watching series and everything, and you can like speak English reasonably well and comprehend English excellently. I don't think there will be any issue, even if you take the TOEFL without preparation that I did. I'm not recommending anyone to do without preparation, but even if you do, you can still easily get more than 100 out of 120. So it's not a big deal. Don't make a big hoopla out of it. If you have to take it, just take it. Next question.
I think there's another. In my next rotation, I'll be rotating with 3 different attendings, 2 attending for 1 week, 1 for 2 weeks. How can I build rapport in this situation and use this situation for my favor? I think it's a very limited time that you have with each of the attendings, but obviously you can make the most out of it. Make sure you're on time or early to do pre-charting, as we said. Make sure you're proactive. Make sure you know what they expect of you in that limited time period. They expect you to do charts. They expect you to present case reports. What do they expect? So be frank and ask them what they expect of you. And I guess just do what they ask. That's pretty much it. But I'm pretty sure like it's a very limited time to ask for a letter of recommendation. It doesn't hurt to ask. But again, I was afraid of asking for a letter of recommendation in the 2 weeks I observed with one of my attendings. But again, the worst we can say is no. Doesn't hurt to ask.
So, as a follow-up to this question and the advice I gave in during my talk in how to excel, like you should ask, do you know me enough to write me? Would you mind writing me a like strong recommendation of strong letter of recommendation in support of my residency application? Do you know me enough? Or do you know me well? If the answer is no, if the answer is like I'm not comfortable, or I don't know you that personally or professionally well to write you a good strong letter of recommendation, you can always follow up with let's say like can I extend my rotation for 1 or 2 more weeks so you can evaluate me better and then write me a strong, like, okay, the focus is getting on strong letter of recommendation. You can use that leverage to extend your rotation as well if the time and your time gross timeline everything permits. It might work well in your favor. Like suppose attending is on the fence about you, he can grant you 1 or 2 weeks more, maybe later, but it will definitely earn you more experience and a better letter of recommendation. Next question.
I think the next question is it possible to get anesthesiology? I think, if I'm not wrong, there is an IMG this year who matched into anesthesiology from one of the social media posts. I don't know if anyone can shed some light, any of the panelists can shed some light on this. I'm not too sure about this question either, so but I can look up the stats for you and see if I can find something for anesthesiology.
See, there is like you can get into anything. Obviously, the probability will differ, and it also depends on your profile and the effort you put. People get into neurosurgery, people get into plastic surgery, being an IMG. So anesthesiology is definitely not out of the scope, but you have to research by asking people who already got into it by being IMG, like what is required for it. Maybe research, maybe more like publication, maybe more experience. I don't know. I'm not an expert on that, especially in anesthesiology. But you can definitely ask around, ask people who has already done it. Not ask people who hasn't done it. Then that will give you nothing. That will not be a useful insight. But ask people around. You can definitely, by probability, you can definitely get into it. Next question.
One of my friends is an IMG from Egypt who matched into anesthesiology this year. She matched at Mayo Clinic. And in Rochester, she did a research here over there, and she did some other research work also and rotations. But I'm not sure she graduated recently, so her YG was probably 2022 or 2 mostly. So I think it's possible. Yeah.
Okay, next question.
Yeah, I think this one is for me. When you volunteered as a receptionist along with an observership, was the doctor supportive of the role in view of the B1, B2? Yes, I was on B1, B2. So when I went in and asked if they needed any volunteering around the clinic, so she told me that they're short-staffed and I would be able to examine patients. I would be able to take their history and, write it in the charts. So that happened for a week. And the next week I was like, oh, can you teach me more about insurance forms? That is something that we do, that we are expected to do once we graduate. And along with that, the one thing that comes up in pediatrics is the school health forms that are like standardized school health forms by the AAP. So I just had a doubt and I was like, can you make this more clearer? And she was like, oh, yeah, you can, you can take calls and you can put in the insurance forms for me and stuff. So that is how basically I segued into receptionist work. And I started, whenever we didn't have patients, I would take calls for appointments. I would schedule appointments. I would, send in scripts for maybe a wheelchair, maybe insurance scripts, whatever was needed. So that kind of helped me make the rapport stronger with the attending, and that led her to, write a better LOR for me as well. It was not, it was technically volunteering. It was not uh, a work experience. It was not a paid job either. It was technically an observership, which I turned favorable for me, I guess. Yeah. I hope that
To
answers
a-
your question.
To add on this,
Yeah.
there are a lot of gray areas regarding visa. Doing clinical work on B1, B2, or like I would say, the very unique experience of being a receptionist on B1, B2. But so I would say you can do anything you are allowed to do, but be careful at two places. One is at visa consulate officer when they ask the question about it, like what did you do or what you are going to do. Don't ever say like you are going to be paid for BMBT or you are doing this job. Be very careful and be prepared about it, like what you say over there in consulate office. Second is your ERA CV. Like suppose I did some hands-on thing on during my observership, but I wouldn't definitely write that I did that in my ERA CV. I try to be as close as possible, but be technically correct about it. So be very careful what you write and what you say at visa office. Otherwise, try to do whatever you can do. That's fine. Next question.
Do we have any more questions? Oh, my graduation year is 2018. After that, I completed my residency. As my year of graduation is 2018, is it hard for me to get into anesthesiology? I guess again, we would not be the best people to ask for that. I think it depends on what residency you did and what are the stats they're looking for when you're applying for anesthesiology. So your best bet would be, I think, to contact someone who's already gone through that process. Like I would be the best person to ask if you're applying for a pediatrics residency program. These guys would be the best people to ask if you're applying for an IM program. So I guess get in touch with someone who's gone through the anesthesiology residency program to know more.
All right. So I think okay, that's we are wrapping up the question. We are like near the time limit as well. So I thank all the panelists, all the speakers for such an insightful discussion, and all the audience as well to encourage us uh, to do more to help people and to guide everyone along the process for the like obstacles or difficulties we already encountered during our thing as well. So thank you. Next Sunday's topic would be about ECFMD certification and pathway certification, pathway 1 to 6, OET and everything. So it would be a more of a technical thing. I don't think there would be more subjective things about it, but still it is demanded. That's why we are presenting. Otherwise, everyone can read up on USCFMD website. It is very easy. Anyway, so see you soon. Thanks for joining our session. Goodbye.
Thank you.
And yeah, anybody can note Poorvi's email, and probably everyone has my email as well. Rest of the people, speaker can write their email if they are comfortable, or Instagram ID or whatever. It's up to you. You can reach out for doubt as well. All right. Okay.
All right.
See.
Bye.
Until next time. Bye bye.